Hello everyone. I invited my sister-in-law Sophie Beaumont, who is a dentist, to talk about a number of things, including oral health and gum health and anxiety and mental health. Given that that has been one of the complaints that we have had with our clients, or one of the things that we're seeing, obviously anxiety. And reporting clenching the teeth and so on. I thought I'd bring an expert to tell us all about it.
Sure. Well, I think firstly it's important to recognise that having good oral health and dental health is really important for your general well-being. If you don't have a good oral health, then it makes speaking and chewing and doing everything we need to do with our mouth quite difficult. Also, what we put into our mouths will not only affect our dentition and our oral health, but our general well-being. So I think that's important to keep in mind. So good oral health is simple things like having a good nutritious diet, but also brushing regularly, using floss, using a fluoridated toothpaste, drinking plenty of tap water, and just maintaining a good healthy oral environment. Now, as you mentioned, the heightened anxiety and stress can often lead to a tooth clenching or tooth grinding habit.
Yes.
And you said that some of your clients have been experiencing this at the moment.
Definitely, yeah, especially at night time, and then coming back to us with tension in the jaw.
Sure.
Or even, depending on how bad it is, sometimes even fractures.
Cracked teeth.
Yeah, cracked teeth, yeah.
So I think it's important for people to be aware of when this is occurring, to try and keep the teeth apart as much during the day. So really becoming aware of it and giving your jaw plenty of rest.
Okay.
So generally speaking, your teeth shouldn't be touching together at rest. And the only time we should be using our jaws is when we are talking or eating. So the rest of the time, your jaw muscles should be relaxed. So awareness is probably the most important thing. Sometimes just doing some gentle massage around the muscles is quite helpful, and using some over-the-counter pain medication is also quite a good thing to relieve the symptoms. But I would suggest that if this is becoming a very acute problem, so people are finding it's difficult to function and chew and carry out a normal day without the pain, they should really seek some professional advice.
Would you say, Sophie, or would you recommend buying an over-the-counter mouth guard? Going to a chemist, for example, and buying
Good question. So they can sometimes help a little bit, certainly protect the teeth, but they don't generally fit very well. So people don't find them comfortable and they don't wear them. So it might be a good solution for a short-term goal, but I think longer term you really need to seek professional advice from a dentist. And if there's a need for referral to an oral medicine specialist, they'll be able to work that out.
Okay. Yeah, that's good. Okay. What about any tips for parents with children and brushing their teeth, or also talking about oral health?
So I think one of the most important things for children is their diet, actually. So keeping them away from sugary drinks, especially between meal times, is really critical. So water is definitely the best thing for children to be drinking, or for all of us to be drinking. And avoiding sort of sugary snacks especially. So snacking is a really important one with children, and giving them the option of healthy, nutritious snacks that are good for the teeth, such as fruit and veggies and cheese and nuts and things like that are very good for the teeth, but good snacks. But brushing at least once a day before bed with a soft toothbrush and a fluoridated toothpaste will also be very important for children's oral health. So I think they're the most critical things, but I'd have to say probably diet is one of the easiest things to modify for children to keep them away from the sugary snacks and sugary drinks.
So sugary drinks, are you talking about soft drinks or juices or
all
both?
Of those things.
Okay.
Fruit juices, soft drinks, energy drinks, flavoured milks, anything that's got added sugar to it. So that definitely includes fruit juices, yes.
Okay. And what about in terms of recommending a toothbrush? So, for example, I had one of our parents here saying that they struggle brushing their teeth, the children's teeth, and they thought that maybe having an electric toothbrush would be the way to go.
Be fun.
Would you?
Yeah, absolutely. If that works, that's absolutely a good idea. So anything that makes toothbrushing fun and enjoyable and makes the children do it. But I would also recommend that adults or parents should be helping their children brush their teeth probably up until the age of 10, because children generally don't have adequate manual dexterity to really clean the tooth and the gum surface very well before then. So let the children have a bit of a play first, but then I think it's a good idea for the parents to help support them and show them how to get to those areas themselves.
Okay. And just one last question. How often would you say, or what would you recommend in terms of visits to the dentist, just as a checkup?
So everybody's different and everybody will have different risk. And that can depend on your basic oral hygiene, your diet, whether you're on medications that make your mouth very dry. And there's a lot of other things that can sort of work together to give us an individual risk. So I think it's difficult to make a blanket statement. I think it's very important for people to see their dentist, for their dentist to work out what that risk is, and then work out the time frame, the time required for recalls. So it's a very individual risk profile. And I would also say that for people who have access to a concession card, that you can go online to Dental Health Services Victoria and find out where the closest community dental clinic is. And that will be a lot cheaper, a lot more affordable for people who have a concession card, because private dental treatment, as you know, is quite expensive for people. So if you do have a concession card, I'd urge you to go online and find out where the closest community dental clinic is.
Okay, great. And I know that I said I was going to ask you one last question, but one last question. You mentioned medication and dry mouth. And a few of the clients that we see here do take medication and talk to us about having a dry mouth. Do you have any tips on how to manage that?
Yeah. Not only the dryness, but some of them can also potentiate the tooth grinding and clenching. So that's another thing to keep in mind. But the dryness in the mouth,
the drugs or the medication that they take can result in clenching the teeth. Is that
it
what
can
you're saying?
exacerbate it. Yeah.
Right. Okay.
So dryness in the mouth, it's important obviously to keep well hydrated. So if you're not drinking enough water, then you can't make the spit. So you don't have the saliva in your mouth to begin with. So keeping well hydrated is very important. Sometimes sucking on sugar-free mints and things can help stimulate some saliva. Gum we don't generally recommend because it can lead to jaw pain with the excessive chewing. There's a lot of saliva substitutes and dry mouth substitutes available, commercially available ones. So it's very much an individual choice, but limiting excessive intake of caffeine will also help. Limiting nicotine will also help, and maybe having a chat to your doctor about whether some of those medications can be modified somewhat to reduce the effect on the dry mouth.
Okay. Well, thank you, Sophie. That
My
was
pleasure.
very informative. So Sophie has kindly offered to also put together a sheet, information sheet. So we're going to put up that on our website, and that's going to have different resources that people can access. So thank you.
Pleasure.